Assalamualaikum and good morning to our audience in the studio and at home. We are back on Live with Monday Talk. I'm Miss Ashfa as a moderator for our forum today. Don't forget to tweet and hashtag Monday Talk to make our talk trending. First of all, I would like to thank all the audience in the studio for attending and not forgetting the viewers at home who always support this program. Basically, we will discuss an interesting topic with our professional panelists. As for today, we have invited six people from different positions and backgrounds as our panelists. Introducing to you our first panel, Ms. Adliena, the Deputy Secretary General in Finance of Ministry Health Malaysia. Our second panel, Ms. Irdina, the Health Director for Kedah. Our third panel, Ms. Farhah, Chief of NGO that actively helps the B40 community. Our fourth group, Dr. Puteri, a senior lecturer from UiTM Kedah. Our fifth panel, Dr. Mazriena, as representative from a government hospital. And lastly, Dr. Wardina, as representative for a private hospital. Our topic for today is healthcare service should be free. So to start our forum discussion, I would like to ask our first panel's opinions regarding this statement. What do you think, Ms. Adliena?
Okay, thank you, moderator, for such a nice introduction. And I'm so honored to start the forum first. So regarding your question on my opinion for the statement of healthcare should be free, I would gladly say yes, I agree with the statement. In terms of the economy, commonly people would say that free service might lead to financial burden towards the government. But in this context, free healthcare service actually can lower administrative expenses because it refers to the cost incurred by insurers, hospitals, doctors, and other entities to conduct the business side of healthcare. So based on my readings, one research conducted by the National Academy of Medicine in 2010 has identified that unnecessary administrative costs as one of 6 key areas that need to be addressed to bring a greater value and lower cost to healthcare consumers. So here I can see that the only way to reduce excess administrative spending is through providing free healthcare service. This is because in a free market economy, you can see that doctors have to deal with myriad number of private agencies in order to purchase that required medical resources. However, under free healthcare, the government acts as an agency that controls the price. So medicine can be bought in bulk and doctors won't have to negotiate with any private agencies anymore. Also, there will be no competition between health insurance companies, and instead, the government regulates healthcare costs, and this drives the cost of healthcare down substantially.
Excuse me, sorry Miss Adliena for interrupting. I was wondering, how can the administrative cost be reduced when the government is not negotiating the price with any private agencies?
Okay, good question, Dr. Wardina. So to be clear for you and others, when the government provides free healthcare, they will be the only buyer for prescription drugs and medical equipment. So prices will remain regulated and there is no room for multiple vendors giving different quotes. So that's how a free healthcare service can lower administrative expenses when the government does not have to negotiate with any private agencies. So that's all from me. Thank you.
Thank you, Miss Adliena. I don't understand what you are trying to say, but I disagree with you, Miss Adliena. So my point of view about this issue is yes, of course, free healthcare will lower administrative expense, but it also can make additional budgetary strain on the government. This is because healthcare is remarkably expensive. There are various costs that the government must bear if it offers free healthcare system to people, such as the cost of medicine, equipment, and so on. According to the National Library of Medicines, the medical price index in Malaysia has increased more than the consumer price index. The substantial cost for the government would result in the country going beyond its debt ceilings. Thus, because of that, the government would have to raise additional taxes from the public. Additionally, it is impossible because low-income groups' ability to pay taxes would remain the same. As a result, Many of the country anxiously look for cost containment measures and different sources of financing, including cost sharings. This is not a good thing.
I'm sorry, Miss Irdina. I can see your point there, but I have a question for you. What is the approximate percentage taken from the government's annual budget if free healthcare is given to the public, and what they will do?
Thank you, Ms. Farhah, for the good question. So, free healthcare service can take up to 40% of government's annual budgets. They might have to cut off the budget separated from other government services such as education. Thus, it brings a negative impact to our country. Thank you.
Thank you, Ms. Ardina, for the clear answer from Ms. Farhah's question just now. So, we will continue to the third panel, Ms. Farhah, the Chief Executive for Protect Health. You can give your opinion on this issue. Thank you.
Thank you, moderator. I'm also agree with Ms. Adina. In my point of view, free healthcare is an initiative we should have because it can improve children's health. For example, by giving vaccine to babies in government clinics, this initiative is very helpful for those who have low incomes and cannot afford to go to a private clinic to get a vaccine. Vaccination is one of the most effective public health interventions in the world for saving lives and promoting good health. Babies are among the most vulnerable groups where they get infected, so it is important to get a vaccine because their immune system is not yet fully developed. According to the Ministry of Health, to prevent disease, vaccines also work well in sync with other global health tools such as antibiotics and breastfeeding. This method is safe, effective, and protect loved ones and society. In fact, childhood immunization saves about 2 until 3 million children every year. Although this vaccine is only for disease prevention, it is very helpful, especially for those who have a weak antibodies. Hence, healthcare must be provided from early age. Everyone knows that vaccines are expensive and not everyone can afford them. So I as NGO and also a group representing B40 also thinks that this initiative is very well implemented and it will be a bit of loss if these opportunities is not used well. If children get vaccinated, they will be spared from various diseases and they can help their life. That's all. Thank you.
Thank you, Ms. Farhah, for your point, and I understand what you are trying to say. But I disagree with you, Ms. Farhah. Did you know that free healthcare has far too many benefits that outweigh the small portion of the population that might abuse this newfound medical freedom? Since the beginning, has been dealing with a fear of the cost to maintaining a healthy life. For example, as you know, social health insurance is a practical approach that involves collecting a pool of funds from those who are earning or working, their employers, and sometimes even the government. So, for free healthcare is not valid because it will make a person irresponsible with what they are trying to do. That's all from me.
Thank you. Thank you so much, Ms. Farhah and Dr. Puteri, for such a detailed explanation. So far, we have already discussed on the economy and society aspects. Now we will give the platform to our respected doctors from public and private hospitals to express their thought. So how about you, Dr. Mazriena?
Thank you, moderator, for asking for my opinion. I would say that I agree with what Ms. Farhah just says about these issues. My point of view is that free healthcare saves thousands of lives. There are numerous patients who may not be able to afford health services, even in critical condition, and can easily go to the hospital for treatment. This is where the government has to play the main role, which is government have a responsibility to keep their citizens safe with assured healthcare is available for free. Good health is an essential requirement for human survival. It is fundamental human right and as such should have available to all. Without good health, human cannot survive. we all have the right to enjoy good health. As we can see, most developed countries provide free healthcare to their citizens. Free healthcare has been proven to work based on several metrics such as treatment costs, average hospital stay, and readmission rates. According to a study conducted by the Commonwealth Fund in 2014, the US healthcare system is ineffective when compared with the 10 other countries surveyed. The unavailability of medical care within people's budget may have been one of the reasons for this outcome. This is why the US has some of the highest state rates for preventable health issues. When people cannot afford to pay the healthcare, they do not go to the doctors or the hospital. Therefore, government have a duty to protect their people. A free healthcare system will help diagnose disease earlier and save more life.
Excuse me, Miss Mazriena. I have a question. What preparatory and complementary measures are needed for free healthcare policies to be successful?
That was a good question, Dr. Puteri. So, a variety of preparation and complementary measures are needed for free healthcare policies to be successful. Firstly, sufficient financial resources need to be provided to the facility level to compensate for both the loss of revenue at the provider level and the desired increase in the use of services. Secondly, provider payment methods and effective allocation channels must be in place before a free healthcare policy come into effect. This is also critical in incentivizing health workers. Next, diagnosing and addressing the factors that prevent the poor from using priority health services are all critical to ensuring free healthcare policies benefit the most vulnerable. Then health services must be made available to the most distant and vulnerable population groups. A related measure is to increase the autonomy of health service providers. And lastly, policymakers need to look for synergies and ensure that free healthcare policies lead to a coherent health financial architecture. That's all for me.
Thank you, Ms. Mazriena, for the opinion that you gave just now. I understand what you are saying, but I don't really agree with you that healthcare should be free. I believe that healthcare should not be given for free because it will lead to the decrease of the services. I have to say that if healthcare is provided for free to everyone, automatically the number of patients will increase immediately. With the increase in the number of patients, it will have a bad effect on the quality of service. This is because doctors and nurses are forced to work day and night to treat patients. Because of that, the quality of service by them will decrease because they don't have enough rest and have to work overtime and their schedule becomes tight. In addition, if healthcare is provided for free to all, the goals of frontliner, which are doctors and nurses, will change immediately. Their original goals was to diagnose patients with the correct diagnosis. However, because healthcare was provided for free, their goals changed to treat as many patients as possible. This followed a sudden increase in patients. As a result, I am very sure that healthcare should not be given for free because it will decrease quality services.
I'm sorry to interrupt you, Dr. Wardina. I'm still confused. In Malaysia, there are many doctors and nurses who can treat, right? So my question is, why can free healthcare decrease the quality of services?
Thank you for the good question, Miss Irdina. Yes, I admit that there are many doctors and nurses in Malaysia who can treat patients. However, due to the increase in patients increasingly dramatically because healthcare is provided for free, doctors and nurses are not able to accommodate and divide the work due to the number of patients who come is beyond the limit. Because of this, healthcare should not be free to everyone.
Thank you, Dr. Wardina, for the clear explanation. I would like to ask a question to Panelist Farhah. Is the initiative of giving vaccinations to children for free during COVID-19 pandemic season well received by the B40 community?
Thank you, moderator, for the question given. Through the research and feedback received, this initiative received a good response from the community because it helped children from B40 families to get vaccines for their own protection. This is because not all groups can get vaccines at private clinics, especially families with many children, which definitely require high financial costs. Not only that, according to Malaysia Ministry of Health, the result of the vaccine dose given to children is based on given higher effectiveness and the potential to provide longer protection. That's all. Thank you.
Thank you, Farhah, for answering the question. Now, this is a question and answer with the audience. So, if anyone in the audience has a question and wants to ask, just turn on your mic.
Thank you, moderator, for opening the question section for the audience. I have one question. So my question is it true that free healthcare is important to society? Is true? Why?
Thank you for the question. So, any panel would like to answer?
I would like to answer the question from the audience. Anyway, it's an interesting question. Thank you for asking. The answer to the question is true. Is it important to society? Why? It is because universal healthcare equalizes service with no doctors or hospital being able to target and cater the wealthier clients. That means everyone get the same level of care, which ultimately leads to a healthier workforce and longer life expectancy. When a person has universal healthcare from birth, it can also lead to a longer and healthier life and reduce societal inequality. I hope this answer answers your question. Thank you.
Thank you, Dr. Mazriena, for such a detailed explanation. Now, I would like to open one more question from the audience. If you want to ask the panelists, please turn on your mic.
Thank you, moderator. I was wondering how free healthcare provided to the public can give benefits to a country economy. That's all.
Okay, I'm interested to answer this question. Thank you for asking. So my answer is simple. When the health of citizen improves, the economy of a country may also improve. This is because the economy is managed by the people. So when the majority of the people are healthy, they will be more productive to do their work better, which result in economic growth. So I hope this clarify your queries. That's all.
Alright, thank you so much, Ms. Adliena, for a simple but detailed answer. So we have come to the end of our discussion. I would like to say thanks again to fellow panels for the informative and interesting talk, and also a big expression for the audience for our participation. Hopefully today's forum will be beneficial for everybody. Once again, thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.